An introduction to anatomy. The key behind everything is that what you are doing right here is just paving a way, momentarily way, that will enable you to understand the concepts, and it also acts as a root of the backbone of medical knowledge. So there are key subjects or units that you really need to know, inclusive of what we refer to as human anatomy and physiology as well. So this is the introduction to human anatomy. So the definition here of human anatomy is simply the study of the structure of the body. Remember, just like the framework which is composing any matter or any structural object, it has to have independent entities that together are compiled, and then through a given art of design they give that object its shape or structure. So what composed human? The entity that is things to do with the structural basis, be it bone, blood, be it tissues, be it cells, that is what we call anatomy. So the study of this structure of the body is what we call anatomy. So if you are told to define human anatomy, this is just but a discipline in medical science, or in the field of medical, that deals with the study of the structure of the human body. So we have human beings here in question, because we as medics, we do evaluate on human beings, and not not animals like dogs or cats, but specifically human beings. That's the unique anatomical features. Talking on divisions of this, human anatomy is divided basically on the ground of what is being discussed or studied. So we have gross anatomy, microscopic anatomy, and developmental anatomy. Those are the three main divisions of human anatomy. You have gross, microscopic, and developmental anatomy. So in the gross anatomy, the study of body parts as seen with the naked eye. What we are able to see, obviously, from direct observation, that is the arm, the limbs, be it on the upper or the lower, that is the limbs, ears, eyes, nose, chest, stomach, all those portrayed. Again, if you are able to observe an organ, let's say lungs, the heart, the liver, that is gross anatomy. So these are study of body parts as seen with the naked eye. And the two approaches to the study of gross anatomy are topographic and systemic. So as a medical student, you are supposed to evaluate organs of the body based on either topographic way or systemic way. Topographic is generally over the terrain, then systemic is from one system to another. Remember what you learned in high school, the body has got many organ systems. Now, talking about that, these are just but what we call, these are now the gross anatomy, what we are able to view and see. Posterior body region and their terms. We have indication of occipital, the back of the head, acromial, point of the shoulder, brachial, your arm, cubital, the region at the elbow, sacral, between hips, perineal, down between your gluteal or between your two thighs. Then popliteal region, back of the knee. Still have the plantar, the sole of your leg, dorsum, the back of your body, the lumbar. Also dorsum is on the fore back of your leg, the leg itself. We still have gluteal, the other, that is buttocks, femoral, the thigh, then the crural is leg, in Luo we call it ogualo. Away from that, mnaweza kaona hii skeletal, and there you're able to see that the arrangement of the skeletal Actually, this is endoskeletal. We have mandible on the cranium, clavicle. So these are just general outlook of what gross anatomy entails. The scapula, the thoracic vertebra, the lumbar vertebra, the entity that you had already discussed sometimes back. And for you to have a close summary of the entire thing, be friendly with the atlas, human atlas of human anatomy, because you are just supposed to be able to name all the muscles in the body, like on what you are able to see from your hand in this picture. The frontal belly, occipital, plantaris, the muscles nomenclature, the naming of the muscles given on, like this muscle called the sternocleidomastoid. The sternocleidomastoid is a kind of muscle which has got three root terms which are joined. Because it's originating from the sternum, we start with the sternum. Then it passes over the clavicle, we have the clinoid. Then mastoid, because it is attached or inserted at the mastoid. So the nomenclature and the naming of the body muscles are exhibited by some relativity and obvious reasons which are easy to interpret. So the terms can sound very tricky, but if you understand how the root name is derived, you'll be in a good position. We have deltoid muscles on the top of the shoulder. Mostly deltoid muscles is where most of the vaccines are done. The intramuscular injections are given to. So their key analogy is very important in your entire medical course. You also need to know the Vectoris Major, especially for female who are at menopause. Some of them come for cosmetic surgeries. They want to be repaired, so you need to know the alignment of pectoris from the insertion point, the origin, so that you can be in a position to repair cosmetically, do a corrective surgery, and you earn your money. Rectus Abdominus, you need to know them, the six packs, the external oblique muscles which are lining literally to the rectus oblique muscles, So away from that, I'm sure if you watch this one in YouTube, you'll be lucky to see what I mean when I read those terms. You need to know the muscles which are aligned in the thighs, the pectinus, the sartorius, the rectus femoris, and the vasta medalis. Similarly, you are supposed also to know the vastus lateralis. And when we are testing on the motor skills, maybe when you are doing general examination or systemic examination, when you use the patella hammer to check on the reflex, the jerky reflex on the knee, you need to know the muscles which are responsible for that. This is another image now. This image shows the circulation. Actually not circulation, but the innervation of nerves. How the nerves moves in your body. So these are just gross anatomy still. We haven't reached into microscopic, though the microscopic aspect of it entails the miniature developmental apex. So away from that, you can see we have this image here showing circulatory, the circulation system or cardiovascular system. There are venous circulation and arterial circulation, and you're supposed to be in position to draw of the same. And again, even think that when common carotid artery, which diverts over into the body and the cranium, and it forms the circles of Willis, you are expected to know the labeling of aorta by a direct observation to human being. Remember, there is variation depending with the size of person, with the height. If you're told to locate where the aorta is in a small baby and where the aorta is in the old man, you really need to be quick to find it. When you're doing resuscitation injection, the adrenaline injection on the cardiac muscles, you're supposed to be able to locate the cardiac muscles without counting the rib space. So entirely the most ambiguous part of all this aspect, that you're supposed to know how the blood moves, the direct organs which are aligned with the circulation of the vessels. You are expected as well to be in position to draw the circulatory system, to master the names of each and respectively the veins and the artery. when you're doing the intravenous injection on the lower arm, you really need to know the location of the veins, the mid-cubital vein, right? The intermediate and antebrachial vein, the cephalic and basilic vein on the arm. So that is that. And most probably those are very essential. In case of DVT, deep vein thrombosis, which is cardiovascular disease resulting from defective valves on the lower limb, or maybe thrombus, coagulations of blood, red blood cells coagulating inside the veins, you need to know the direct veins which is affected, and the calf vein or the saphenous vein at most they come. And that tendency of the pain radiating, or maybe a diffused pain, should also be possible for you to know its location directly. So that is that. So away from that, let's proceed. Then we have, this is what we have, the human respiratory system. You're also supposed to be able to, so this is systemic approach. Nasal passage, we go system to system, oral cavity, this is respiratory system. You need to know all of the component of the respiratory. Similarly to the digestive system, know the salivary glands, parotid, sublingual, submandibular, and where they are located. Parotid are laterally at the cheeks and the facial bones, and then we have the sublingual below the tongue, and then submandibular under them or within the mandibles. Now that is us. So you need to know the systems and the organs, the structure and the composition, not reproductive. So let's go. That was gross. Let's go to microscopic. Microscopic, it entails studying infinite and miniature things which cannot be viewed directly by your eyes. So these are molecules, the metabolites, the elements of chemical like DNA, which are hidden directly inside the cells and the nucleus. So at most, cytology comes in, histology comes in, because cytology now involves studying of the component of cells to realize any pathological defects or maybe normality. On the other side, histology is the study of tissue. So all these ones are microscopic substances, and cell is so small, tissue are very small, and examining them require microscope and not naked eyes. So when you evaluate on the cells, you need to study of cells. We will focus on the cell structure, the cell functional specialization, the cell cycle, the cell division. So you need to know the cell division as well. So instantly, let me give a clue on what I mean when I say cell structure. Remember, we have components of the cell, like from the membranous part of the cell, that is the cell membrane, the bounded organelles with the membrane. You need to know the component of the membrane in terms of what are the possible structure, the protein, the lipid, the phospholipid, which are placed between the biproteinous membrane, and the lipid head and the tail of the lipid, the one which is hydrophilic and hydrophobic, or rather the lipophilic and lipophobic. So you need to know these structures, the integral component of the cell membrane, that is including the peripheral receptors and the integral receptors, or the enzymes, the molecular determining parts of the cell membrane, be it let me talk about the carrier molecules, etc. You need to know them. Similarly to the cytoplasm and the cytosol, you need to know the component of the cell organelles internally. Then you come on cell functional specialization, like for example a sperm cell. You need to be able to know how sperm is adapted for its function or effectiveness. Instantly when you talk about the cell functional specialization, similarly when you talk about guard cell in high school, talking about photosynthesis, you realize we had that tendency of hypertonic solution, the cells up of a guard cell, that will equivalently raise the osmotic pressure for it to bulge. So specialization in a cell is very key, because collectively it enhances the property of a cell and therefore a tissue and therefore an organ, and finally the organ system. This is a kind of a very long thing, but entirely is of great aperture. You need to know how sperm cell is specialized in terms of the mitochondrion, That is that you also need to know the hepatocytes, the cells of the liver are specialized. So not only one cell but all of them. Like cells of a liver are able to regenerate after they are damaged, they can regenerate and again grow. You also need to know the cell cycle, that is mitosis, division, and you need to move by cycle on the phases, the gap phase 1, gap 2, the synthesis 1, synthesis 2, the interphase, until you come back again. And then check on the cell division. All that one is important part of cytology. Away from that, we have the cell itself. So you'll be able to see this, the hierarchical organization of the cell. You now see from atom, we have atoms combined give us molecule. For example, hydrogen, carbon, and oxygen will give us a molecule of glucose. Then the glucose, the compound plus protein will give us macromolecule. Then when you combine this one, we'll get Golgi apparatus, or we'll get lysosome, that is now an organelles. Then several organelles will give us the cell. Then the cell combined several typical one give us tissue. Similarly, many tissues combined will give us organs, and then the organs which are synchronized and coordinated to perform a specific function will give us an organ system, which furtherly will give us organism. So that is what I was telling you: atom, molecule, macromolecule, organelle, cell, tissue, organ system, organism, which is now you. So all of the system and the component of your body are destined towards a simple and one function. So however, wherever, because of what and not what, the important considerations comes in. Very key attribute plays in. The one thing that I don't need you to forget, that each of your body parts are synchronized to perform a function which is effectively towards your entire body. When your eyelid is torn, blinking your eyes will give you a pain, and therefore that will entirely interfere with your vision at one end. So independent entity of your body are synchronized, coordinated to effectively deliver function simultaneously. Even your leg alone, even your skin are just functionally important as any other part. So anything affecting them will entirely cause discomfort to the entire part of the body. Talking about histology as another microscopic aperture of studying anatomy, here now you'll be handling tissues. You will be dissecting tissues. You will be taking them for slides preparation, viewing, checking on the analogy. Similarly, basic tissues, histological structure of various body. Then at least with a tissue you are able to know the disease state of an organ. When you take a liver tissue and you go and examine it using a microscope, you know how the liver functions as an organ. And if an organ is directly informed of, then you know how the organ system works and entirely how the body works. If cardiac tissue is not properly contracting, entirely the blood will not be adequately pumped off from the heart to the entire body. And so through that, entirely another expectation is that the body will lack oxygen and nutrients, which are key vitals in terms of cardiovascular system. Those are the main function apart from many other functions. So there will be necrosis, and the body cell tissues will be dying. And so that will also lead to the entire body dying. So components of a tissue. You need to know tissue is not a tissue from nowhere. It has to start from the cell. So we have a cell playing in, then we have matrix, and the matrix now is what now control, that is what now give a structural orientation of the tissue. The glycals, aminoglycans, the ground substances, which are one of the fibrinogens, the fibrinogens, the fibers, which within their same we have connective tissue, whose cells are like the mast cells, right? The macrophages, the fibroblasts, the plasma cells. Those are now the typical cells in the connective tissue. Then the same tissue, we have tissue fluid. Tissue fluid is ultrafiltrated part of blood or from the capillaries which birth the tissue. So their main function is to bathe the cells inside the tissue and provide them with what they are able to, they really need, oxygen and nutrients. So tissue fluid is always identical to most of the lymph, so you don't mistake it with the lymphatic fluid. but it also forms the lymphatic part as it drains back off, being reabsorbed from the ventral end. It can, some remnants join in the lymphatic system and circulate from the lymph. 4 basic tissues. You need to know these ones. We have 4 basic types of tissue, and that is where everything in anatomy starts from. Epithelial tissue, hizi ni kama ngozi za nje. Their main function is just to cover the body part. I mean, the inner linings of some organs, like the inner lining of your mouth, the buccal epithelial, the oral epithelial, the vagina epithelial, all that even your skin is an example of epithelial. So you need to know the type of epithelial as one type of tissue. Muscles and propulsion, connective or supporting, nervous, all that one. Those type of tissue are very important. So this is an example of epithelial tissue. We have them named depending on how they look like. The squamous, the cuboidal. Cuboidal is a cube in nature. Columnar, column in nature. So that is to mean they are triangle. So we have the unilaminar, the simple ones, yeah, and multilaminar. So you're gonna see that in later ground. So again, you can have a nice time and go and read over this, so that you know what we refer to as pseudostratified. Pseudostratified, they always pretend to be more than one layer, and yet they're one layer. So we call them pseudo. They are just false stratified. So you need to know which kind of epithelial is found in your specific cells or tissue organs, like the gustatory for the taste bud in your tongue, which tissues or epithelial layer do they have, olfactory in your nose, stratoacoustic in your ears, what epithelial do they have, male epitheliocyte in your bone marrow. So that is that the proportions of tissues is a key thing, that is in terms of muscles, how the muscles contract. You need to know the element of muscle that takes contraction in the H band, the Z band, the A band, and the I band. How the sarcomere contracts simultaneously to reducing the length of the muscle, and therefore your entire motion is initiated. Within the sarcomere, we have tiny proteinous molecules. We call them the myofilaments, made up of the actin, right, and the myosin. So the actin and the myosin filaments, they are the ones which are helping in the process of contraction. And they are very small, but they are very powerful. Nervous tissue, that is what you're able to see from this video, and that is what it entails. We have the axon, the strong cells, the dendritic, myelin sheath. All these ones are very key and important as well. So, right, you need to know the part of the nerve cells, the axon terminal, how they relate. So by reading extra, you will get to understand. These are bone tissue. See, we have the vasial system, osteon having blood vessels in between. Yeah, you have the inner circumferential lamellae, which are quite like in circular path. The Volkmann canal, which entails the blood vessels root. So that is bone tissue. That's how your bone looks like. So let's talk about that. Is done of histology, I mean the microscopic anatomy. So let's talk about developmental anatomy, which compose of the development only. So we have the gametogenesis. Gamete means the sex cell. So how the sperms is developed or originates, the ovum as well. So for the ovum we call it oogenesis, and for the sperms we call it the spermatogenesis. Then we have fertilization. The fertilization, that is after the the ovum and the sperms fuses. Then you have early development, which starts at 1 and 2 weeks, and implantation that takes place. Then you have the embryonic period, 3 weeks to 8. You need to know exactly these weeks. Then you have the fetal period, week 9 until birth. Development 1 at start, that is what you are able to see from the chromosomes, the sex chromosome playing a role. We have the oogenesis also on the other hand, and then we'll have a complete mature ovum and a sperm, which is very erotic as well. Then you have now developmental 2, that is after fertilization, and all that process comes into oocyte implantation. The baby develops, forms an embryo. Then development 3 is what you're able to see from your hand. You can pause the video and internalize it, something important to do, and check until all the organs are formed at long last. And then anatomical terms comes into play a role, that is anatomical position, body planes, terms of position. So you need to know anatomical positions, body planes, terms of position, terms of movement as well. So likely is an important attribute that I don't need to assume that anatomical positions are very key in many basic formalities. Now, for instantly, anatomical position will give you a location of given organ, how can be interpreted during surgical operations to your colleagues in the surgeon laboratory or the baba. We call them the baba. The body planes also tell you we have a typical 4 planes or 5 planes talk of, right? So you'll see the cross-sectional plane, the sagittal, all those ones. Then the terms of position as well, and the terms of movement as well. So here are some of this is an anatomical position of a man. A man is called to be anatomical position if he's standing both legs uprightly, the palm on in a supinated way, with the palm facing forward, the facial is upright, and the mouth is closed as well. Don't open your mouth. Anyway, that is not significant. Then check on the body planes. So on the body planes, we have frontal coronal plane, we have transverse or horizontal plane, we have posterior, we have anterior. Those are now directional. So the planes are only, they're only 4. Oh no, they are actually 3. They are 4 because we have also oblique, which is not indicated here. So we have frontal, we have right transverse, we have frontal, we have transverse, then we have sagittal. Sagittal can be parasagittal or mid-sagittal. If you have any question, please don't forget to ask. Terms of position, location. Terms of position and location. So you need to know this one. Terms of position, just like superior means upward toward the head, inferior lower toward the legs, anterior toward in front or away from the back, posterior backside. So that's what I mean. So I'm sure these ones you're already informed about because you need to know them. Superficial is outward, deep is the opposite of superficial. Terms of movement, flexion is reducing the angles of your body, like your arm. Extension, increasing the angles. Terms of movement, flexion is extension. Abduction is directly opposite to abduction. Medial rotation, lateral rotation. Circumduction, circumversion. Supination, pronation. Opposition, reposition. Elevation, depression. Protraction, retraction. So that is all that. You can see them. Adduction, away. Abduction, away. Adduction toward the midline of the body. Circumduction, rotating it at one plane. Eversion, hivyo tu unaiepua. Inversion, unairudisha. Dorsiflexion, plantar flexion, and then that's called the end of this. Thank you for watching over this, attending the lesson through the videos, the YouTube. Please don't forget to subscribe. Do not forget to subscribe. In medical students arena, you can search that one in YouTube always and subscribe. Thank you and have a nice time. The same notes are in our website.